This one we're going to talk specifically about learning objectives 1 and 2, which are in the OSU thread of excellence in clinical practice. And we're going to talk about what that looks like even for those that are not in a clinical practice setting. So again, a reminder, this capstone is meant to be student directed, and hopefully these are areas that the student has interest in. And what the challenge is then is to take these learning objectives that OSU has and fit them into the experience at your site. So now we're going to kind of talk a little bit about matching these learning objectives up to site and site mentor expertise, but then also kind of keeping in mind that we want it to fit within OSU's curriculum and also to what the student is interested in learning. So again, we're going to talk about this thread number 1. So the objective is student demonstrates excellence in clinical practice through the provision of evidence-based evaluation, intervention, and discharge planning. It's really wordy, but really it means that the student is going to do something related to evidence-based practice. So the way we want you to think about this, it's like coming up with a site-specific objective, specific, to you and the student. And I want you guys to think about what you want to achieve at the final first, and then work backwards to determine what would that evidence of accomplishment be for the midterm. Again, I have examples for non-clinical. So this is what the form looks like. So again, what we're going to think about is what is at final, what might this mean for the student, and then what might be a stepping stone to get there. And so this is the column that you and your student are going to fill out before the experience begins. These two columns you'll do at midterm and final, and this one over here does not change. So objective number 1, it could be independence with a certain evaluation or intervention technique. Ideally, and then it would, because the objective is about evidence, it should be a technique that's backed by research and is something that site mentor has expertise in. Most of the students and experiences, this is covered because we've already looked at what is it they're interested in, where are they going, who's their site mentor. So a lot of those criteria should be already taken care of. So it could be seeing that client of a certain diagnosis from admission to discharge, right? That whole episode of care. It could be managing a percentage of a caseload similar to level 2. In a non-clinical setting, think about consultation or a population level. What technique, equipment, or space could be implemented for an entity or a setting, site's population that they serve? Is there a body of literature that would maybe be useful in servicing the setting's clients? So examples in number 1. So by midterm, the student will take thorough inventory of the clinic's vision assessments and provide information on validity and reliability to the site mentor. And then by final, that the student is competent in administering a vision assessment with at least 2 clients. So, you can start with that final. This is about vision. I want to know they can do these assessments. It needs to be evidence-based. A step to them being competent is really what might also benefit our clinic, is knowing what do we have and what's the validity and reliability on each of these assessments. And maybe is it tailored? Maybe this one's really great for brain injury, but this one's really great for glaucoma. And so that's a way that these clinical objectives can match what the site needs, the student's interest, and the site mentor's expertise. A second example, that by midterm, the student establishes service competency with the site mentor on administration of at least 1 standardized assessment. But then at final, they're going to take it further by them being competent with co-evaluation and co-treatment with physical therapy of post-open heart surgery patients independently, using at least 1 standard measure. And this would be like an acute care type of thing. And we know that we need to get a little better at it about using outcome measures sometimes. So that would serve the facility. It would fit the caseload of the site mentor and the interests of the student. And then for a non-clinical type of one, we have one here. By midterm, student locates resources of both scholarly and non-scholarly types, meaning websites and other resources versus a peer-reviewed journal, regarding the use of handrails to prevent falls in outdoor spaces. And so by final, the student has provided education to administrative staff regarding the benefits of these handrails, including approximate costs and locations for handrails at the site. So that's a way we can take that idea of clinical practice, serving a population, and putting it into a non-clinical setting. So learning objective number 2 is demonstrating excellence in clinical practice through the provision of compassionate, empathetic, and client-centered occupational therapy. And so again, you're not going to do anything with this column. You're just going to fill in midterm and final right now, and these two will be done at later dates. So for your non-clinical people, you want to think about, will the student have interactions with any clients at the site? A lot of this could fall under customer service. Will the client or the student be designing an intervention for the client? And so, or a piece of equipment, or designing the use of a space. So how, through the design of that thing, would they be keeping in mind the unique needs of that type of client, client-centered? So that might be for this entity has a lot of kids with disabilities that come and they need better accessible bathrooms. And so keeping the needs of all children with disabilities in mind, by midterm, the student's going to compile resources on accessibility options, such as bathroom changing tables, following universal design principles. I don't know where the word principles went. And that by final, they'll present to administration a plan for which resources need to be obtained, including rational cost and training. So this one, I probably should have written those to talk a little bit more about focusing on the population and making sure that it's client-centered or site-centered, whereas in my first example is very similar, but is more about the evidence behind it. So the first one being more about the evidence, and then this one being a little bit more about the site-specific, client-centered, meeting the needs of clients and or site. So clinical examples, I think, are sometimes a little easier to wrap their heads around. So demonstrating therapeutic use of self, indicating compassion and empathy during initial interview by midterm, and that by final, they'll independently demonstrate principles of family-centered care and high levels of therapeutic communication skills with families during each patient treatment session. So we're starting it with just therapeutic use of self, compassion, empathy during initial interview. And then I want to see them be able to get past that initial interview and really talk about therapeutic communication through an entire session, right? Which we know getting through a whole session when, kids or clients will say things and being able to therapeutically handle that is very different from sort of a semi-structured interview. Another example, by midterm, to complete and document a thorough occupational profile with at least 2 clients. And that by final, using motivational interviewing in specific to complete that occupational profile with at least 2 families in order to develop the treatment plan. So those are the first 2, and there'll be more videos about the knowledge and translation and the professional development.